Welcome. Today we'll speak about the environment and health. We'll focus on the large burden of environmentally related health problems, who is most affected by this burden, and measures that can be taken to reduce the burden of environmental related disease. By the time you finish this session, you should be able to speak comfortably about the importance of environmental factors to the burden of disease, the key environmental risk factors and who they affect, some key measures that can be taken to reduce the burden of environmentally related disease, and some of the possible impacts of climate change on that burden. Let's begin with some vignettes that can help us to appreciate and illustrate better the links between the environment and health. Tirtha is a 5-year-old girl in Nepal. She lives in a small rural home, and her mother cooks indoors with no ventilation to the outside. They use dung as fuel. Tirtha has had a series of respiratory problems related to the way in which the family cooks. Vathani is a young mother in Cambodia. She lives in a poor area in the north. She gets her water from an open stream, and she doesn't treat it. She has 3 young children, and the children have had frequent bouts of diarrheal disease. John is a 7-year-old boy who lives in a rural area in sub-Saharan Africa. Very few of the families near John's homes have toilets. Instead, people defecate in the open. Hand washing with soap is also not very common in the area where John lives. And one of the important contributors to the poor health of young children like John is the lack of improved sanitation and the limited extent to which people hand wash with soap after they defecate. Joy Hearn is a 75-year-old woman who lives in Beijing, China. The air in Beijing is notoriously polluted. On some days, the level of air pollution greatly exceeds the recommended norms of the World Health Organization. Joy Hearn often finds it very difficult to breathe, especially on days of high pollution. She also suffers from chronic respiratory problems. These are all examples of the impact of environmental issues on human health. Thus, before going any further, it would be helpful to note the definition that the World Health Organization uses for environmental health. And I'm going to take the liberty of reading it. And I'm going to do so because as you think about, work in, or study global health, what you'll find is that many people use very broad definitions of the environment, often suggesting that practically everything relates to it. The World Health Organization's definition is a narrower one. That's the one I prefer to use, and that's the one that we're going to use as we have our discussion today. So WHO says environmental health comprises those aspects of human health, including quality of life, that are determined by physical, chemical, biological, social, and psychosocial factors in the environment. It also refers to the theory and practice of assessing, correcting, controlling, and preventing those factors in the environment that can potentially affect adversely the health of present and future generations. It's a long definition, but I think it relates in understandable ways to the way in which most of us think about the environment. Now, some examples of environmental health issues are shown on the next slide, and they're organized in 3 levels. One is the level of the household, the second is the level of the community, and the third refers to global issues. And I want to encourage you to think about environmental health issues in this way because I think it's a useful manner for categorizing them and will help you make your way through the very, very wide range of environmental health issues and problems, even using the definition that we're going to use. Some examples of environmental health issues at the household level, as you would surely appreciate, are unsafe water, inadequate sanitation, and inadequate solid waste disposal, and improper hygiene, which is extraordinarily important. Crowded housing and poor ventilation of smoke, and exposure to naturally occurring substances can also be an important environmental health issue at the household level. At the community level, we can talk about improper water resource management, exposure to vehicle emissions, and industrial air pollution, as all of you will also surely understand very well. And globally, there are two substantial issues, of course, that are very much in the news these days. One is climate change. The second is ozone depletion. And again, I encourage you, as you make your way through thinking about environmental health issues, to categorize them in this way, which I think will really help you to make much better sense of them. Now let's talk for a second about the importance of environmental health factors to the overall burden of disease. There are a number of organizations, including the World Health Organization, the Institute of Health Metrics and Evaluation, that have made estimates of the extent to which environmental risk factors are important for the burdens of illness and death that we face today. And let's start by looking at, I think the World Health Organization has suggested that about 23% of all deaths are related to environmental risk factors. About 24% of the total disease burden in DALYs in all ages and both sexes is attributable to environmental risk factors. And it's also been estimated that about 33% of the total disease burden in young children is related to environmental risk factors as well. Now, the Institute of Health Metrics and Evaluation suggests that about 15% of all deaths in all age groups for both sexes are attributable to 5 environmental risk factors, and let's look at them here. The first is unimproved water. The second, poor sanitation. The third, ambient air pollution, which is outdoor air pollution in simple terms. The fourth, household air pollution. And the last, lead. So let's probe these a little bit and talk a little bit further about several of these issues and the burden of disease that's related to them before we talk a little bit about how it is that those burdens might be addressed. Many people in the world, especially poor people, cook indoors using coal or wood or dung, for example. WHO estimates that about 3 billion people use solid fuels for cooking. Now, these fuels don't completely combust. They leave behind some gases and chemicals, and many people, especially the poor again, cook in areas without proper ventilation of smoke from their homes. So some of us probably believe that outdoor air pollution, what they call ambient air pollution, is actually the most important, or among the very most, maybe the most important of all the environmental risk factors. But in fact, household air pollution is a more important risk factor for ill health than outdoor air pollution is. And in fact, WHO estimates that in 2012, more than 4 million deaths from stroke, ischemic heart disease, acute lower respiratory infection, lung cancer, and chronic obstructive pulmonary disease were actually attributable to household air pollution. The WHO regions of Southeast Asia and the Western Pacific shared most of that burden, which would relate, as you might expect, to issues in both India and China. Now, at the same time, ambient air pollution, outdoor air pollution is a very important environmental risk factor. And this graphic I hope you'll agree, nicely presents some of the pollutants, examples of how they're manifest, and some of the health effects that relate to them. The most common effects of ambient air pollution are respiratory symptoms, including cough and irritation of the nose and throat and shortness of breath. Certain people have pre-existing health factors, which of course make them more susceptible to these risk factors and make those risk factors more dangerous for them, including younger people and older people as well. The World Health Organization estimates that ambient air pollution contributed to 6.7% of all deaths in 2012. They also estimated that about 16% of the lung cancer deaths, 11% of the deaths from chronic obstructive pulmonary disease, and more than 20% of the deaths from ischemic heart disease and stroke are attributable to ambient air pollution. And again, India and China, as we might expect, given their large size and diversity, have major burdens of disease that relate to ambient air pollution from particulate matter, as they call it. UNICEF and the World Health Organization estimate that about 90% of the world's population does have access to an improved water source. But even if that's true, it still would mean that about 750 million people in the world lack access to safe water, and about 200 million people depend on open water sources. In parts of sub-Saharan Africa and Oceania, for example, less than 50% of the population has access to an improved water source. Moreover, even water that is called safe often is really not so safe at all, because it often contains dangerous pathogens. And waterborne diseases, as I'm sure everyone would understand, are among the most important burdens of disease in low and middle income countries. Only about 60% of the people in the world have access to what we call improved sanitation. This ranges to over 80% in the better off region of Latin America, Caribbean, but to about only 30% in the less well-off region of sub-Saharan Africa. In fact, many of the largest cities in sub-Saharan Africa have no sewage system at all. And in many of the larger cities in Asia, the sewer system is very, very incomplete, and large numbers of people don't have access in those cities to improved sanitation. UNICEF and the World Health Organization, in fact, estimate that about 2.4 billion people out of around 7 billion worldwide were without improved sanitation in 2015. WHO also estimates that about 1.5% of the global burden of disease was attributable in 2012 to poor water, sanitation, and hygiene. The burden of disease from unsafe water and unimproved sanitation falls disproportionately on poor people, poor families, and on young children. In children, this is often manifest in diarrheal disease, which is one of the leading killers of under 5 children worldwide. Environmental health issues are also very important attributable risk factors for respiratory problems that are another very large cause of under 5 child death worldwide. And it doesn't take much to understand, again, why these disproportionately affect the poor, because it's the poor who live in more rural places, it's the poor who have less improved housing, it's the poor who have less access to safe water, improved sanitation, and as we'll talk about, who also have less knowledge of and ability to manifest good hygiene practices. So let's speak briefly now about measures that can be taken to reduce the burden of environmentally related disease. And this is going to be quite simplified. There's an extensive literature on measures that can be taken to reduce the burden of environmentally related disease, and I want to encourage you to pursue it further. It has much more detail and much more information both about what's been tried, what's worked, what the lessons of experience are, what best practice might be, and the relative cost effectiveness of different approaches. So with some, but only modest apologies, let me outline in fairly simple terms some of what we know about can be done to address some of these most important environmental health burdens. To reduce household air pollution, cooking devices can be improved, families can use less polluting fuels, and families can reduce their need for these fuels by switching to solar cooking, by using improved stoves, as I mentioned, as well. Some changes can also be made to the living environment through improvements in ventilation, or the kitchen can be moved away from the main part of the house so that the family members breathe in less smoke. People can also change their behaviors to reduce pollution or exposure to it by using dried fuels, properly maintaining their stoves and chimneys, and keeping children away from the cooking areas. Now, of course, none of these are really easy to do. All of them require changes in the way people live and have been living often for a very long time. But we understand that these are some of the measures that, if taken, can, at relatively low cost, produce substantial health benefits by reducing the health impact of household air pollution. Public policy can also play a useful role in reducing the impact of household air pollution. The public sector, for example, can promote information and education about the measures that we just discussed. It might use tax policy to incentivize people's construction of or purchase of improved cooking stoves. It might even choose, for example, to subsidize fuels that are less polluting especially, for example, for those people who are below a certain income level, can't afford those fuels on their own, and might be subject disproportionately to the negative consequences of indoor air pollution or household air pollution. Outdoor air pollution, ambient air pollution, is a matter with which many of you are much more familiar, so I'm just going to say a few words. But we have seen in a substantial number of cities in the world a number of measures that in cost-efficient ways have substantially reduced the burden of outdoor air pollution. And these include introducing unleaded gasoline, using low-smoke lubricant for two-stroke engines, or banning two-stroke engines altogether, shifting to natural gas to fuel public vehicles, and reducing the burning of garbage. Now, water, when we think about water, we understand, and it's clear that the maximum benefits to health will come from household water connections. And some of that benefit seems to come from the fact that when people have household water connections, they actually have enough water, they can use some of it for engaging in good hygiene practices, including hand washing with soap before they eat, after they defecate, for example. But we also know that household water connections are expensive. And for some time to come, many communities in a substantial number of countries will have to depend on low-cost approaches to water supply and water supply schemes. Similar issues will arise in sanitation. The cost per person for methods of sanitary removal of human waste varies considerably. At the bottom level of service, one could probably construct in some countries simple pour flush latrines, ventilation improved latrines, and simple pit latrines for less than about $12 per year. On the other hand, we know that the construction of conventional sewage is very expensive and often more than 10 times that amount. So here too, when it comes to improved sanitation, many communities in a substantial number of countries will have to depend on low-cost approaches. But everybody should understand at the same time that there's a major effort underway right now to encourage the development of simple, low-cost toilets that will be affordable to the poor, easy to install, and could be major contributions to reducing the burden of disease from unimproved sanitation. Now, here too, I would be remiss if I didn't say, trying to change behaviors to help people reduce open defecation and to use toilet requires an enormous amount of behavior change. It's never easy. Nonetheless, there are a number of countries that have made substantial progress in doing this. Two of them are Bangladesh and Indonesia. These efforts are not without controversy. Some people believe that by using public shaming as one tool, for example, to help shift behaviors, that this may not be appropriate and that better or more appropriate ways need to be found. But there's an extensive and growing literature on efforts to try to promote behavior change, to incentivize and move communities toward reducing open defecation, and I encourage you to read it. Now, when we talk about water and sanitation, as I say to my students, it's always better to think not just about water, not just about sanitation, but to think simultaneously about water, sanitation, and hygiene. There are benefits that will accrue from improved water. There are benefits that will come from improved sanitation. But there are many more benefits that come when improved water and improved sanitation are linked with efforts to improve sanitation and improve hand washing with soap. Here too, there are a number of examples, and Senegal is a very good one, which has been widely reported in the literature and studied carefully, where efforts were made to improve hand washing with soap at the community level after people defecated in order that they could enhance the health benefits both from that and from investments they were making in water and sanitation. This is a graphic that looks, in fact, at the cost per daily averted of selected investments in water and sanitation. Ideally, again, everybody would have a household water connection and an improved toilet in their home. This, I have to repeat, is not going to happen for some time to come. And so for quite some time in a fair number of countries, they're going to be operating down here. And that is seeking cost-effective ways of trying to ensure that open defecation is reduced and that families have access to improved sanitation, improved water sources, and that they couple those uses with hand washing with soap. Before ending, let me make just a couple of comments about climate change. Climate change refers, as you know, to the increase in the Earth's average temperature that has been observed and the consequences that might be associated with that rise in temperature. Climate change is also considered a significant threat to the fight to improve the health of poor people in the poorest countries. Now, WHO has estimated that climate change could cause an additional 250,000 deaths per year between 2030 and 2050. More specifically, WHO has estimated that climate change will lead to approximately 38,000 additional deaths due to heat exposure in elderly people, 48,000 deaths per year due to 48,000 deaths due to diarrhea, 60,000 due to malaria, and 95,000 due to childhood undernutrition. Now, all of you will appreciate that the mechanisms by which climate change might have an impact on human health are complicated and will go in a variety of different directions. In fact, some people might be better off in some places, while others might be worse off in other places than those. But some of the mechanisms through which climate change could affect health might include, for example, drought, variable rainfall and its impact on hygiene and agriculture, and higher temperatures being associated with deaths through increasing cardiovascular disease or higher levels of pollution. A Lancet commission, and Lancet is a well-known journal that deals with public health, medicine, and it has extensive reporting as well on global health. A Lancet commission has indicated that everyone is at risk to be negatively affected by climate change, and the well-being of billions could be put at risk. Nevertheless, some people are probably more vulnerable than others. In particular, low-income countries, and in some cases middle-income countries as well, could be affected to a greater extent because areas with weak health infrastructure will be least prepared to respond to the impact of climate change. In addition, it's anticipated that urban areas will be affected to a greater extent by negative impacts of air pollution than rural areas would be. And within all countries, young and elderly people are generally disproportionately affected by health circumstances related to the environment because they're more vulnerable, less able to take care of themselves. In the short term, the public health community can prepare for the negative effects of climate change by enhancing public health education, improving emergency preparedness, engaging in warnings about pollution, and et cetera. There will also be possibilities that we will need to enhance public information about waterborne diseases. In the long term, mitigation efforts will probably revolve around reducing emissions of greenhouse gases, particularly carbon and methane emissions. So there's some measures we can take to help prepare, and there are other measures that we can take to help mitigate the potential consequences of climate change and its impact on human health. We've seen that a large share of the global burden of disease is attributable to environmental risk factors. Among the most important of those are household air pollution, ambient air pollution, unsafe water, unimproved sanitation, and poor hygiene. We've also seen that a range of cost-effective investments can address some of these problems in ways that have been shown to make a difference, but that it's going to take some time before many people in communities in low and middle income countries can reach some of the solutions like this that may produce the most health benefits but are substantially more expensive than low-cost approaches to water supply and sanitation coupled with better hygiene. And we've also mentioned a bit the importance of climate change or to the potential burden of environmental risk factors on people's health. In the next session, we'll speak about nutrition and global health.